Welcome back to HealthTech Explorers. Today, we're diving into how AI is transforming medicine and why there are no longer any truly safe specialties. Many people assume AI will only affect radiology or pathology, while specialties requiring more human interaction will stay the same. But the reality is different. Medicine is full of algorithms, protocols, and standardized workflows. If a process can be described step by step, even if it takes years of training, sooner or later AI will learn to handle it. How AI is reshaping medical specialties. Diagnostics and imaging. AI is already analyzing millions of MRIs, CT scans, and X-rays, detecting early-stage cancer, rare conditions, and subtle fractures. Systems from companies like Philips and Microsoft help clinicians catch critical cases faster and improve diagnostic accuracy. Clinical decision support. Platforms like Epic and Microsoft DAX process huge amounts of data, from genetics to electronic health records, to deliver personalized recommendations in oncology, cardiology, infectious diseases, and beyond. Surgery and treatment planning. Even surgery, which often seems like pure craftsmanship, relies on precise models of anatomy and biomechanics. Today, AI helps plan procedures, simulate outcomes, and even assist with robotic surgery. Psychiatry, psychology, and primary care. AI-powered chatbots and virtual assistants support triage, mental health screening, and patient education. Research shows they sometimes detect emotional cues better than overworked clinicians. Workflow optimization. Documentation, scheduling, reporting, lab data processing. AI takes on repetitive tasks, giving doctors more time for complex cases and direct patient care. Personalized medicine and prevention. Using decades of data, AI predicts disease risks long before symptoms appear, opening doors to proactive care and tailored treatment plans. Why this is good news? Yes, AI touches every specialty. But it's not about replacing doctors. In reality, the best results come when AI handles routine tasks, while physicians focus on complex decisions, ethics, and human interaction. What comes next? Adoption in healthcare is slower than in other industries because of safety, ethics, and regulation. But this is exactly why learning to work alongside AI is becoming essential for clinicians at every level. So here's the key takeaway. AI in healthcare isn't the future. It's already here. It's reshaping every specialty, and the real opportunity lies in using it to deliver smarter, more personalized care while keeping humans at the center. Thanks for watching. If you liked the video, don't forget to give it a thumbs up and subscribe so you don't miss any future videos. See you next time.